lost my insurance 3.5 years ago, have not qualified for Medicaid since then.
We have 10 to 20% of good, hardworking people in this country that work for minimum wage. Because he works for McDonald's and her Burger King does not mean that they shouldn't get some kind of coverage from the system they're paying taxes into and be invited to the well to drink out of.
We can't be about families and let families be torn apart and suffer and die because our politics say we don't want to help them.
I see people and meet people all the time who don't have health care coverage, who have difficult things, sometimes terrible things happen to them because they didn't have coverage that could have had coverage if we would have had Medicaid.
Odds are there are lots of people just like me who are very sick, who could be terminally ill, who have no medical care, who are going to lose their lives because they do not have access to basic health care.
Medicaid helps people like me who are decent, hardworking people who don't think we're entitled to anything but life.
Well, I can tell you about one of my patients that would have benefited from the Medicaid expansion, but it's too late now. She lost her job in the economic downturn of 2009. She had always had a job before that and had run some of her own businesses before. And unfortunately for her, right at that time was also when she was diagnosed with breast cancer. She purchased Cobra to continue getting some insurance coverage even after she lost her job, and was able to get the cancer removed from the breast. And they said to her, well, we think we got all the cancer, but you never can tell for sure when you take it out. But they said, this is not a benign thing. This is a very nasty cancer, and you need to get chemotherapy and you need to get radiation. But by the time she got that far in her treatment was right when her Cobra was running out. She couldn't afford any more Cobra. That was $900 a month. Cancer came back, and now she's on hospice. She'll die within a couple of months. She's confined to her bed now, and she's gonna die without ever having gotten the treatments that she should have gotten. But that's the kind of person who, next time around, might get the right treatments because of being on Medicaid.
We've had 3 commissions now. We've spent $600,000 of taxpayers' money studying this. They've all come back with the same conclusion. Take the money.
We probably see between 15 and 25% uninsured patients here every day. Well, the reason the patients come here is they primarily have no other place to go. For one thing, if you had Medicaid through the expansion, or if you had the federal block grant with private insurance, which is how Healthy Utah intends to run the program, you would have then access to offices, and you could establish a working relationship with a primary care physician, specialists, and other people, and then you could call them up or make appointments and get seen. Preventative care, routine care, urgent care.
We take almost $4 billion this year, $4 billion in federal money for transportation, to make sure wolves don't get in here, for every kind of water program you can imagine, corporate welfare. But no, when it's helping Utah families that are struggling to get health care insurance, nope, we have a principle we have to stand on.
The full expansion basically has between 138 and 139 about 138% of the federal poverty level, are those individuals who would be eligible for this particular coverage or expansion. Now, the similarity with the governor's plan is his income levels are at the same level, about $15,500 or about 138% for an individual. And the differences, as I see it, is he intends to ask the president and the secretary for a federal block grant.
Stop playing with the lives of tens of thousands of Utah families. Take the full Medicaid expansion money that we've paid for.
I hope that the secretary and the president are smart enough and wise enough to give Governor Herbert and our state this money, and then we can help start immediately taking care of these patients. It'll be a big deal for the state of Utah.
It's a good program. We've got 3 years to test it out. Let's take the money for the 3 years and let's help a lot of Utahns have a good life.
We'll literally save lives with the Medicaid expansion.
So I have another friend. Her husband is on disability and has some serious health problems. So he gets a small amount of disability money each month, about $600, and he is on Medicaid. For Sherilyn, she has autoimmune liver disease and she has fairly serious lung disease, and she needs some medications that help keep those things in control. But what she's been told is, if you had $400 a month less of income, bearing in mind that the only income they have is her husband's $600 a month of disability income, then you could qualify for Medicaid. So they can get one or the other of them covered, but not both. So she intermittently goes without her medicines, and they both kind of skimp on how much medicine they get. It's crazy.
My name is Stacy, and I'm 29 years old. And 4 years ago, I was in a pretty serious car accident. I was really lucky and walked away from that wreck with some minor injuries. Started going to the doctor with a backache, which progressed to legs, and got to the point where I was losing mobility and therefore was fired from my job. It was an autoimmune disorder which was triggered by the car accident, kicked my immune system into high gear. Now my immune system is attacking my central nervous system, which means my brain and my spinal cord are decaying. I'm losing my vision, starting to lose my hearing, cognitive memory loss, trouble finding words, can no longer walk. I have episodes of paralysis and loss of movement in my arms, extreme pain that goes on and on and on and on. So my symptoms have continued to progress, but my access to insurance and my access to healthcare has not gotten any better. Lost my insurance 3.5 years ago, have not qualified for Medicaid since then because A, disability Medicaid requires a documented diagnosis from a physician, which I cannot afford to get because I cannot afford doctor's appointments and scans in order to confirm exactly what is going on in my brain. And B, I do not qualify for regular Medicaid because after my accident and after I lost my job, I wanted to be a good enterprising American and I started a business. And so I make just enough money now that I do not qualify for regular Medicaid as it exists today. So I'm continuing to get infections, I'm continuing to decline with no access at all to medical care. I have very few prescription medications because of the lack of diagnosis, but even those, very often I'm choosing between food or medicine.
I was drafted in the United States Marine Corps in 1969. I served in Vietnam. I'm a 30% disabled, service-connected veteran with an honorable discharge. September 23rd, 2013, my wife had a stroke about 9 o'clock in the morning. They took her to the hospital and she had had a stroke, which they had to clean out her artery, and then they did tests and found an aneurysm on the side of her head. So through these 2 operations, bills skyrocketed, and it was apparent that we had to file bankruptcy, which we did. I'm retired. I get Utah retirement, a vet's pension, and Social Security. My wife had no health insurance. She worked for minimum wage. I'm taken care of for everything that is service-connected, and I pay co-pays on everything that isn't. But my wife could not get so much as an aspirin from the VA system and never has. We get $45 a month, and if she gets her name on the back of my gravestone, that's it. That's complete from the VA. The minute she had the stroke, her $1,200 a month was gone. We were at $1,700 for 2 people, with a house payment, car insurance. I could not get any assistance because I was just a few dollars over. We are going through a divorce because all the stress and the fights over this thing. Her son owed me money and her son-in-law, and they wouldn't give us a dime, and I was mad, and she thought I blamed her, but I blamed the system, and she thinks she's at fault, and she has a lot of mental problems, and I'm helping her with an apartment, but this has really destroyed her quite a ways. I ended up alone, going through a divorce, completely bankrupt for a stroke I didn't even have. Well, people think Marines don't cry, but they do.
Another patient, she's got 2 kids, one of whom has fairly severe mental illness. She's a single mom who her kids are on Medicaid, and she's thankful for that, but she's not on Medicaid. She gets abscesses from time to time, and at times she's been at home trying to cut them open herself with a razor blade because she can't come in to the doctor's visit to get that done with anesthesia to cut them open and drain them. She got sick with gallstones, landed in the university hospital for a while, had some complications after the surgery that had to be done to take that out, winds up with the $40,000 bill from the hospital. The hospital they go through with their financial people to see, can she pay? Well, no, it's pretty clear she can't pay. So then they have other people who go through, and somehow they manage to get her on Medicaid for 1 month. So they get their bill taken care of, and then she gets dumped back off Medicaid. So now she's back as an outpatient again with her ongoing medical needs, again with no coverage. She's very thankful they worked it out for the 1 month, but it doesn't help her long-term situation.
My name is Christian. I'm a front-end software tester for a web commerce company. My experience with Medicaid starts actually 10 years ago when I started in school. At the time we had 2 children, and my wife and I were living in a small apartment, and I have an autoimmune disorder called lupus, which it's very complicated, but basically what it means is my immune system shoots first and asks questions later. But I could never have completed school and dealt with those unusual medical challenges without some assistance. There was nowhere else to turn. It's very difficult for me in my pride to go in and say, I need help from the state. You think, well, I'm the husband and the father. Traditionally, I should be providing for my family. And suddenly you're in a situation where you can't do that. It is very humbling and very difficult to go in and ask for help. And now we're off Medicaid because I got this job with this great company. I'm getting a great salary. I am no longer on state assistance. I've been able to start paying back my student loans, and we have great medical coverage. There's no way that I could be in the situation that I'm in now if I hadn't gone through that process and received that help. It's the state assistance, including and especially the Medicaid, helped me to be well enough to go to school, get my degree, start my career, and that's how I ended up here.
My name is Emma Donges. I'm 15 years old. I'm from Bountiful, Utah. I'm in high school. I go to the Salt Lake School for the Performing Arts, and I'm homeschooled at the same time. And I like theater and operatic singing. I was diagnosed with epilepsy when I was 10. And then it kind of started to shift a little bit because it started not being so much about the epilepsy. I started getting migraines a lot. And we didn't know what the epilepsy was. We just knew it was idiopathic epilepsy. But now we know that it's juvenile myoclonic epilepsy, which is just a fancy word of saying I got it when I was young and I have a certain type of seizures. Then I started having weird symptoms. My left temple started to hurt really bad with like a suicide pain, and I couldn't speak, I couldn't touch it, I couldn't smile, I couldn't do any of that because it would hurt a lot. That ended up going away after a while. And we never figured out what it was. And then I started having other weird symptoms. My entire body started to hurt a lot, and I didn't even want to stand up. I started getting double vision. I started getting really tired randomly, like I just couldn't even stay awake at all. I got a bad tremor in my hands for a while. That's still there, but it's not as bad as it used to be. And the migraines got worse. They got more frequent and they stayed longer, and I ended up having to go to the hospital frequently for that. We had health insurance when it all started happening, but my mom had to start working part-time so that she could stay home and take care of me. My dad died when I was 9, so he's not around to help us out anymore. And my mom is a single parent. I've been getting Medicaid for about a year. It has helped us to be on Medicaid because of MRIs and scans and blood tests. All of that costs a lot of money, and we wouldn't have been able to do it without help because we don't have the money to pay for a $7,000 brain scan. I don't think I would be able to go to school full time if I didn't have these treatments and my pills. If I didn't have the pills that I have, I would be having seizures often, and I would be a lot slower cognitively than I am. Also, I used to be a competitive figure skater, and the seizures took me off the ice. I am as active as I can be, and there are times where I push it a lot and I end up like in tears, just in pain, because I can't do the things that I used to be able to do. Medicaid allows me to go on living my life.
My name is Paul Gibbs. In 2008, I was diagnosed by my doctor with end-stage kidney failure and told that I had to have a transplant as soon as possible. I was, at the time, working part-time for the Clark Planetarium through Salt Lake County. I was going to film school at Salt Lake Community College part-time, and most of the rest of my time was devoted to being a caregiver for the most awesome niece and nephew in the world, Carson and Kaylee, my sister's kids. She and her husband both had to work full-time to support the kids, so my twin brother and I lived there and helped watch over these amazing children. And I was doing all this, but I had no health insurance. I was lucky enough that I had some of the most amazing people in Utah helping me raising money. I have been a member of the Utah live theater community for most of my life, and I had friends coming out of the woodwork. First off, I had one friend who was willing to give me his kidney, and I had the most popular live theater in the state raise money for me before their shows, and they raised over $10,000 for my transplant. It was an amazing and humbling experience to have so many people come to help me, but as amazing as $10,000 was, that was for a $79,000 surgery. And that was only one of 2 surgeries. My kidneys were in bad enough shape that I had to have another surgery to remove both of them 6 weeks before the transplant. And the medications I have to take every day to stop my body from rejecting the kidney are the same in cost as a month's rent on a 2-bedroom apartment for 1 month's worth of medications that I'll have to take for the rest of my life. So I had as great a support system as anyone could imagine to get me through this. And I still couldn't have gotten surgery if not for a miracle. And that miracle was called Medicaid. These ideas we have about the people who need and get help are just rationalizations that we use not to give of ourselves. We like to believe that we're a state that's about families and about moral values, and I believe we are, but I believe in order to be that, we have to be willing to give of ourselves to help Utah families. And I just want the legislators and the governor of Utah to understand that lives are on the line here. People's lives and health are being put in jeopardy while they wait, while they go over the same data over and over again, running the same tests again and again and coming back with the same results, telling them to accept Medicaid expansion.
So I work in Bountiful, Utah. Well-to-do, quiet Bountiful. Nothing exciting about Bountiful, nothing downtrodden about Bountiful. And I work in private practice. I'm not a charity care clinic where you'd expect to see the underserved. And yet every week in my practice, I have a patient who can afford enough money to come see me, or who I discount my fee to see them, but who doesn't have coverage, who would be benefited by the Medicaid expansion, who I can't get them the other treatments outside of their office that they need. So any primary care clinic that you go into, you find people who need this. All these other stories that I've told, and many other people that I know, would have benefited from the Medicaid expansion. They would have gotten taken care of. Their lives wouldn't have been damaged, and for many of them, we overall as a society would have paid much less. We would have saved the cost, we would have saved their life, made their life better, and it's time to get it taken care of.
I support Medicaid expansion.
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 We support Medicaid expansion.
I support Medicaid expansion.
I support Medicaid expansion.
I support Medicaid expansion.
Once I get access to health care, there's so much I want to do. I'm trying to work as a disability activist. I have a blog. I do a little bit of work on the side as a disability activist, and I could do so much more on behalf of my peers if I were healthy enough to get out of bed in the morning, if I were healthy enough to make the climb to Capitol Hill. Right now I am paralyzed by my illness in literal and figurative ways, and I could change the world if I could just get some medicine.
With every passing day, the sky goes darker gray. I lose my faith and you keep your power. My desperation grows each hour. Give me a time, give me a pour. I thought you'd take me, but you shut the door. What would you have me do? All I want is to live like you. You can't dismiss us, 'cause we won't leave. I'll answer your questions, but you can't see. I'm not trying to make you cry, but is it too much not to let me die? Give me a time, give me a pour. I thought you'd take me, but you shut the door. What would you have me do? All I need is to live like you. Why is it wrong to help each other? Save my sister, save my brother. If God is love, can't we love one another?